Hi everyone. My name is Amélie Boudreau, and I am a research professional at the Research Chair on Optimal Professional Practices. Our works aim to support and enhance the role of nurses in family medicine groups in helping them to offer patient centered care and supporting their patients in decision making. It is my pleasure today to guide you through this brief training aiming to introduce you to the concept of shared decision making to support patients who face multiple decisions. So, we don't have any conflict of interests in this project, but I want to mention that we did receive financial support from the Quebec Network on Nursing Intervention Research to launch this training. So, I want to thank them on behalf of all my colleagues. This training would not have been made possible without the contribution of a competent team that included healthcare professionals, patients' partners, decision makers, and members of the virtual community practice of FMGs, nurses, that we want to sincerely thank. Their names all appear on the current slide so you can see the wonderful and dynamic team that we have. The objectives of this training are to clarify the concepts of shared decision making in a clinical setting and also to provide you efficient tools that you can use during an appointment with a patient in FMG. Of course, we don't expect you to be experts in shared decision making by the end of this training, but to feel more confident and better equipped to help your patient in making optimal decisions. So before we go any further, I want to invite you to copy and paste this SurveyMonkey link and complete the short questionnaire that should bring a reflection on your ability and general knowledge regarding shared decision making. I suggest you do it as soon as you can, and by the end of this training, you will be asked to complete it again so we can judge the efficiency of this presentation and support you by providing more content that can satisfy your needs. We have been working on the topic of shared decision making with patients with multiple complex care needs, yes, since 2018. So this was a subsection of a project by the SSA Quebec Support Unit, which is led by Catherine Hudon, a family doctor, and Maud Christine Chouinard, a registered nurse. Then Marie-Eve Poitras, our principal investigator, but also a registered nurse, launched a study aiming to determine the decisional needs of high users, which refers to patients who are frequent users of the ER or with frequent hospital admissions. So we talked with more than 40 patients and asked them about the decisions they have to make regarding their health status. This allowed us to highlight about 26 different types of decisions. I'm not going to mention them all, so don't worry. But if some of you have any interest in hearing more about that, we will make sure you have our contact information so you can reach out. But overall, let's just say that we extracted 5 topics ranging from what professionals do I have access to and who can help in managing my health issues, to the management of my social and physical environments. How can I identify available resources? Also, needs related to adopting a healthy lifestyle, introduction of new medications or treatments. There were also decisions regarding levels of care, since every time a patient is admitted, as we know, he is asked to confirm his level of care again. That's just part of the job. So these are all examples of tough decisions that definitely need some reflection. Finally, there were also decisions regarding the acceptance of health condition and acknowledgement of different psychological and physical chronic conditions. But how do we define a person with complex care needs? There are as many people as there are situations, and that is simply because a patient with complex care needs is simply sorry about that. A patient, yeah, with complex care needs present multiple components like mental, physical, or emotional components, but there's also a social vulnerability. So, as clinicians, your job is to identify these patients. As we previously mentioned, they are high users, but in some cases, some of them can definitely slip under the radar. Here we have the example of Richard. It's completely made up, but very relatable. Richard is a widower who has worked all his life in a hardware store. He has POCD, severe arthrosis in the knees, which prevents him from exercising. He had a few infarctions, but he also unexpectedly lost his wife. So he's in the process of mourning her loss. Since she has died, he can't work anymore and he is experiencing many struggles because his wife used to take matters into her own hands on things like Richard's appointments or medications. So he is experiencing problems with his pulmonary condition right now, with managing the pain. And on top of that, he started smoking again, which is obviously not a good thing regarding his heart and pulmonary problems. So, yes, he is completely effective, but we all know that patients like him are very common with complex care needs, and that it is our job, our responsibility as healthcare professionals to identify them and know that they have multiple physical and psychological needs, and also that they are vulnerable. So they are easily identified because of their multiple chronic conditions. Also, these patients see many healthcare professionals. The reason why it is so important to support patients in their decisional process, sorry, is because the more decisions they have to make, the heavier is their burden. Let's take as an example a patient who faces the decision to undergo a surgery. This might seem a rather easy decision to make, only because there are no other decisions involved. But when there are multiple mental and physical illnesses, then it gets harder because that same patient is constantly asked to make decisions regarding his health condition. It is definitely not the same as having to make a decision once in a while, because in that particular case, there is a redundancy because every time he is admitted in the hospital or goes to the ER or talks to a healthcare professional, for example, then it becomes very hard as a person to be constantly reminded of his poor health, and that adds a burden. It makes it hard to take a decision that makes sense and that we feel comfortable with and that aligns with our personal values, like the level of care. So, let's talk about the decisional conflict. When a patient finds it hard to make a decision, which might bring a decisional conflict that we see in about 50% of patients who experience uncertainties and discomfort regarding a decision that was made. What you'll often hear is, yeah, I made that decision because my doctor told me it was the best option for me, or simply the nurse thought I should do this. Or I chose this option because that's pretty much what everyone chooses. What you should hear, though, is the patient who might be going through a decisional conflict. So that means he's not comfortable with his decision, and that can lead to a patient not committing to a new medication or not engaging in an exercise program. So for you, in the long term, it really just means starting all over again. And there are multiple impacts to that, like not achieving the targets set or giving the impression of not being interested. But in reality, that's because we made a decision that did not respect our values and preferences and didn't get enough support in that process. So there is an impact to that, and even the relationship with the provider can be affected on the long term. Even the perception we have of our health and our capability to manage our health. Of course, there's no certainty that someone will ever experience a decisional conflict, but what we do know is that some patients are more prone to experience a decisional conflict. So there are particular things to consider, like gender, sex, and age, the level of education, socioeconomic status, as well as ethnic group, but also the physical, emotional, and cognitive abilities. So, even though a decisional conflict can occur at any time, what we know is that older men with a low level of education, for example, are at greater risk of going through a decisional conflict. Another example would be a situation where the family unit is of great importance, whether it is for religious beliefs or else, but where there could be some form or pressure towards the family member who is taking the decision. So this could be a decision involving an abortion or a blood transfusion, for example, which are not even an option within certain communities. But these are examples of situation when a decisional conflict can arise. So this is why it is so important to consider all the challenges that are experienced by the patient as well as the person as a whole, and yes, ultimately the quality of the decision. But how do we achieve this? Well, one of the most efficient approaches is that of the shared decision making. That is a dynamic approach between the clinician and his patient, and that favors a long term decision. The main reason we should opt for the shared decision-making approach is that it promotes the inclusion of the patient, which unfortunately seems to be easier said than done, in particular because of a more paternalistic approach or one that is strongly based on empirical data, which is what clinicians rely on most of the time. So, no matter what field we come from as a clinician, whether it is nursing, medicine, physical therapy, pharmacy, or else, one thing we are very good at is transferring knowledge the way we were taught to do so in nursing school or college. However, we are still having difficulties to include the patient as a whole with his values and preferences in healthcare, which is kind of sad, really. So the decision-making approach is an interesting mix of both the clinician's scientific background and knowledge and the patient's experiential knowledge. And that ultimately results in the right decision for the patient. So, what are the benefits of shared decision making? Well, first and foremost, it satisfies the decisional need of the patient in terms of clarifying what the decision is about. It also gives the patient much needed information on who should provide him the information, like a healthcare professional, or should the patient talk things over with relatives or seek their support. It could also be that he simply needs some alone reflection time regarding the options available. Shared decision making is also helpful in enhancing the quality of the decision, but by no means influencing it towards a specific option, though. Also, it maintains the core of the decision. So, for the clinician or the patient as an individual, this definitely makes more sense. What's even more interesting with this approach is how, as clinicians, when we use this approach with the patient, is that we feel more equipped when there is neutrality in the options available or when there is some uncertainty. So, as healthcare professionals, that gives us tools to deal with any scientific uncertainty that might arise. And then our own discomfort as clinicians is reduced when the patient makes a decision and is fully aware of its possible outcomes. Finally, another benefit of shared decision making approach is the fact that it puts patients' expectations into perspective because we know that sometimes they can have false beliefs or even unrealistic expectations regarding the efficiency of a treatment or the change of lifestyle habits to reduce the risk of cardiovascular diseases, for example. So, overall, the benefits of involving the patient in the process by supporting him or providing a space to reflect on the matter or even giving him the opportunity to opt out of the whole process simply promotes a better understanding both for the patient and the professionals on the importance of getting involved in the shared decision making. Now, there is a framework that is widely used in research, but also in clinical practice, and that is the Ottawa Decision Support Framework. The framework and its concepts were created by Annette O'Connor, a retired nurse from the academic community in Ontario. So basically, this framework acknowledges the fact that patients do have decisional needs that involve the identification of the options available, of course, what the decision is about, as well as informational, professional, and personal support and works that need to be included. Also, the patient needs to identify his personal values and his own preferences in healthcare. When we offer helpful and structured support in decision making, whether it is through counseling, decision aids, or any other form of clinical support, that increases the quality of the decision for the patient, but also for you as healthcare professionals. It also gives the insurance that the values and preferences are actually taken into account. So, over time, what we see is that patients feel a lot more confident and experience less guilt and regrets. So, in the end, it also has a positive impact on the decisional conflict. This next slide gives you hints and strategies that you can use, yes, to guide your patient through the decisional process. Regarding that first step, decision making, you can ask, where do you stand today, or do you already have an idea of the direction you want to go? When you feel that your patient has an actual interest, that you already informed him about the risks and benefits for each option, then you can ask him about his understanding of the situation and the options that are available. Let's take the example of a new treatment for diabetes. What you can do is ask the patient to explain in his own words what he retained from what you said, what he really understands regarding the risks and benefits, also the side effects that might be associated with such a medication, let's say for diabetes. So, this is a good way to promote a proper understanding. You could also question him about which family member could get involved in the decisional process. In the case, for example, where the decision consists in ending a treatment or moving into a care facility, some situations definitely need to involve other family members. That is also an opportunity for you as clinicians to detect any pressure that your patient might be experiencing, whether it comes from relatives or friends or any other external source. In the case, for example, of a patient who is undergoing chemo and who could be thinking about transitioning towards a more palliative approach to stop his treatments, but who is experiencing pressure coming from his wife and kids. So when you question like that and you go a little bit deeper, then you can get a good picture of what the situation really is. You might also want to question your patient on self efficacy, competencies, or obstacles. For example, when the options were listed, if he's planning to resume physical activity, there are many possible scenarios like walking for 10 minutes 3 times a day, walking for 30 minutes, or climbing the stairs. These are only examples, of course, but you can check your patient's level of confidence regarding his ability to do one of those things on a regular basis, how confident he is that he can cut down on cigarettes. This could be another example. So, this all generates a discussion with the patient that you can see as an opportunity to assess what are the existing obstacles that prevent him to cut down on cigarettes and see together what are the tools or other aids that could be introduced to help him in his decisional process to favor one option over another. Finally, the end of the appointment is usually the right time to start talking about the next steps regarding the decision. And this is when you can get a glimpse of what your patient's intentions are. It also gives you a peek on how he is processing the information you gave, how he projects himself into the future, as well as what he considers to be the best option. And how does that apply in a clinical setting? So, you can very quickly introduce the shared decision making approach when you meet a patient in your office. You can see on this slide, here are a few questions that you can feel free to use, though it won't make you an expert in shared decision making, and see where you currently stand in this whole decisional process with your patient. Following an appointment with the patient, you might want to reflect on your contribution in identifying the decisions that need to be made. Did I take time to mention to my patient what we would be talking about today? Did I tell him about the different options available regarding that particular treatment? Also, ask yourself if you offered sufficient time and space so your patient did not feel rushed into a decision. If the values and the preferences were questioned, what are the elements that this particular patient considers as prerequisites to a good quality of life? Did you question what his lifeline was? These are all examples of elements that can bring your patient to come up with what he truly wishes for in terms of healthcare. Um, did you mention all the risks and benefits for each option? By the way, we want to be very clear with the patient and make sure that our choice of words doesn't bring any false hopes or that there is no misinterpretation regarding the efficiency of a treatment. So just keep in mind to mention both sides of the medal, positive and negative. Did you use examples? Because as we know, examples are a very good and very efficient way to explain things to a patient that you can base on your experiences. So sometimes just hearing about how a treatment contributed or not to improve someone else's condition can be reassuring, and this is definitely a good way to illustrate what side effects might come up or simply how it could end up being a total game changer and improve his health condition. You also want to reflect on the quality of the assistance you provided in terms of helping the patient identifying what his support needs are. Like, does he feel he need the need to talk things through with his family? Are there any readings you could suggest? Or maybe referring back to the doctor would be the best thing you can do. Sometimes your colleagues or other professionals are more comfortable than you in providing specific information. For example, a pharmacist for the choice of the right molecule, a physical therapist to make sure he can resume sports, or does he need a referral to the smoking cessation clinic? So never hesitate to send the patient see a colleague if you feel he might need a bit more than what you can offer. There are also many associations that you can refer a patient to, like Diabetes Quebec, Diabetes Canada, Hypertension Canada. These are excellent sources to gather information. Peer support is also a considerable asset because when you have access to other people who went through the same thing as you are going through, this is a wonderful opportunity to ask questions that could lead to a better decision. Depending on his current state of mind, maybe today is just not a good day for your patient to make a decision. So you should be aware of that and say that you completely understand that he might not be quite ready. So in that case, he might want to go back home and you'll still be there for him in the end. He can reach out to you at any time and you'll be happy to reschedule an appointment if needed. So just keep in mind that it is perfectly fine if your patient feels that more time is needed. This brings us to the last point, which is a reminder of the importance as a clinician to confirm the quality of the decision. You can rely on many interesting tools that are specifically designed to help in decision making. So you can see here the links to the existing directories in decision aids from the Ottawa crew. They are available in both languages and based on science. If you check it out, you'll see that there are multiple types of decision aids, whether it is for families or parents who might not be so sure about giving their child an antibiotic, for example. There is also a pandemic related decision aid that can help you decide what you should do in case of an outbreak. Also, for weight management, over the counter medication, there are multiple types. So, really, just go and have a look. Of course, if you have a complex care needs patient, then he might not find the specific decision aid that he's looking for, but there is a personal guide that you can download on their website. You can see the link on the lower right corner that you can print and fill with your patient. There are different sections so he can identify his support network. In another section, he can reflect on his preferences, values, his personal level of knowledge. So, overall, that allows a reflection process, and then you can discuss the options together and make sure you take the best decision. Don't hesitate to contact us if you would like assistance or if you have questions regarding these decision aids. Just reach out and we'll be pleased to help. Now I want to present you the SURE test, which is used to detect a decisional conflict. So the S is to answer the question, are you sure about what is the best choice for you? The U stands for understand information. Do you know the benefits and risks for each option? The U stands for understand information. Sorry about that. So, fast forward to the R, which is for risk benefit ratio. Is the patient clear about which benefits and risks matter most to him? And finally, the E is for encouragement. Did the person have enough support to make a choice? At the end of the day, if you question the right things and feel comfortable enough to use decision aids or bring your patient to start a reflection process, then you are definitely on the right path and you're doing an excellent job with this shared decision making approach. If you wish to go further on the subject and learn more, there is a toolkit that is available to you through nursing directorates, but also on our own website. It's an open access, and you'll find videos that illustrate the day to day life of complex care needs patients, plus a video on the role of the nurse in shared decision making. If you wish to spread the word and reach a larger audience, there is content that is available for you to use that can be displayed in waiting rooms, for example. In conclusion, I want to mention that all of our team remains available to assist you in any questions you might have or to provide coaching on shared decision making with your patients with complex care needs or high users. So that concludes the presentation, and we invite you to copy the link to this SurveyMonkey to complete a short questionnaire about your level of knowledge following this training on shared decision making. We would very much appreciate if you could fill it because we value your feedback and use it to improve the content we make for FMG's nurses. We work very hard to promote the importance of their role within family clinics. So, yes, that would definitely make a difference. Again, we thank you very much for watching this presentation and do not hesitate to reach out if you wish to share your comments. If you have questions, we remain available.